Okay, so in this video we will be doing subcutaneous insulin injection. So before preparing the medication, we have to do the 6 rights. So patient, time, dose, drug, route, and documentation. And then we'll check the order. So the patient's name is Skip, and he needs insulin, 20 units subcutaneous before breakfast daily. So we're gonna pretend it's before breakfast. Then he also needs insulin RU, so regular, per sliding scale twice daily at 700, and his glucose is 245, so he will need 10 units of insulin, so 30 in total. So I have 2 different needles to give the injection. So we'll have to check the vial. So this one's already been opened, so we'll look for any cracks, discoloration, anything that looks abnormal, and the nurse's initials and time that was opened and used. And if it's a multi-use, it's good for 30 days, so about a month. And then we'll do this for 1 minute to mix all the medication together. We'll take an alcohol prep pad. And clean the top of the vial. Okay. Then we'll choose a 100 unit insulin needle syringe. So we'll remove the cap. Excuse me. And so this will be the first run, so the 20 units. So we'll pull down the plunger until 20 units just there. And we'll inject the air, and we'll pull back until we get the 20 units. And we don't want any air bubbles. Okay, double check, and we'll have to double check with the nurse, another nurse, to make sure that I'm giving the right units, because insulin is very dangerous if it's not given in the right right dose. And recap with one, so it's like one-handed. And then we'll check with another nurse that it's the right, that it matches the MAR in the order and stuff like that. So then we'll go into the patient's room and ask for 2 identifiers. So his name and date of birth, and it's Skip in January 1st, 1972. Then we'll have to explain what we're giving, so insulin, and we'll explain it's like you get it before breakfast, and we'll do it in the lower abdomen. That's one of the sites is the abdomen, and you want it 2 inches away, or 2 fingers length away from the belly button. The back of the arms is another common site. lower back and upper back. And new one is the side of the legs. Okay, so we'll have the patient laying down, and then we'll grab some gloves. And we would want to ask if the patient has any allergies also. Okay, so we'll have to, when we're cleaning, you do it clockwise, just in circles. And you want it to air dry, you don't want to fan it. So once it's dry, we'll remove the cap, and with the non-dominant hand, you want to pinch the skin up. If the patient is overweight or obese, you want to go in a 90 degrees, so up and down. Or if the patient is like average size, skinny, 45-degree angle. Okay? Okay. So we're going to pretend that Skip is obese, and we'll go up and down at a 90-degree angle. You want to inject slowly. Okay. And you want to put the syringe in the needle. Okay. So then we'll use, if there's any blood, you would want to just dot it with a gauze pad. And you don't want to rub or massage the site because it can just erupt the absorption rate. Okay, and then we'll have to document about what we gave, so the 6 rights of the medication, how the patient tolerated it, and if he want to make sure that he does eat breakfast. Okay. Now we'll do the second one, which is 10 units of insulin. So we'll take another alcohol prep pad. So since we just gave him one in the abdomen, we'll have to either do it in the other side. So if I did it in the right side, we'll have to go in the left or the back of the arm to rotate the sites. Because if we do it in the same spot, then it will build up with scar tissue. So get a new alcohol prep pad and wipe. Circular motions, check the vial, make sure it's the right medication, it's the right time, all of that. So we'll be giving 10 units. So you want to make sure that you draw up 10 units of air. Make sure there's no air bubbles. And then recap it with the one-handed method. Okay, and then it's the same thing. Get an alcohol prep pad, circular motions on the site area. Explain that we're giving him another injection of insulin because he gets it twice daily and it's in the morning still. Okay. And then we'll have to make sure that this is the right dose and the right medication with another nurse. Okay, so then pull the skin, pinch the skin, 90-degree angle, inject slowly, put the needle in a sharps container, blot the area with blood, don't massage, and then document how the patient reacted to this medication, like how he tolerated the injections. Yeah. And you want to make sure that the patient does eat, so his blood glucose levels are within his normal limits, you know, depends on the patient, but you don't want him to go be hypo or hyperglycemic. You can take off